You know this list is on fire, right? You know this list is on fire. It's on fire right now in my hand. That's what I gotta talk to them about. Do you know what the best health insurance plans are in Ohio for 2018? Well, hey, stick around. How's it going, everybody? I'm Joey Giangola with Giangola Insurance, and well, yeah. Your choices for health insurance in 2018 in the state of Ohio, they haven't gotten any better since the last time we talked. And I'd like to officially welcome you to that fantastic time of year where you get to pay more for the same thing that you already have. If it feels like you're the only one, don't worry, because it's definitely happening to everybody, like everybody. Of course, there are plenty of reasons for this, but explaining them to you right now is really not going to do much to quell that homicidal rage that you feel building. But it is my job to help you push that rage aside long enough to make the best choice for you and your family for this year, even as impossible of a task as it might seem. So as you know, this is one of my favorite videos to create every year, and I've been doing it for a long time. But before we get started, let's get all the "I can't believe I'm saying this" statements out of the way, because there are actually a few of them this year. First, say goodbye to your PPO. As far as I'm aware, in Ohio for 2018, there is not a single health insurance company offering a PPO network for their policies. Next, where's the Cleveland Clinic? You might have heard that one of the top insurance companies in the state of Ohio, MedMutual, has decided to, or in some capacity, mutually part ways with the Cleveland Clinic, and they will no longer be offered in their individual health insurance plans network. Now keep in mind, just hold on, pump the brakes. If you have a medical mutual policy through your job, through your employer, if you have it through the SuperMed plan, if it's a grandfather to grandmother plan, all of those plans are not really, I'm not talking about those plans. So it's just the new HMO, Affordable Care Act, Obamacare, Healthcare Reform, ACA, whatever you want to call it, it's just those plans that are going to take this network hit. But again, anybody that is looking to buy new health insurance this year would be, again, on your own, would be looking to buy one of these plans. Or if you've already had an Affordable Care Act plan for the last couple years, this is going to impact you as well. And finally, Anthem is not selling health insurance in Ohio in 2018. This is going to follow suit much like companies like Aetna and United did last year. Anthem is doing their kind of disappearing act for 2018. But what does this mean? It just means that you're going to have one less decent choice throughout the state of Ohio. So I really don't know if I want to sit here and talk to you about this whole thing, because I am working through this. I need to get out of here. Let's go. I got to go up to the office, and I thought, let's just talk about this on the way up there. That probably seems like a good idea. Let's get into the lists, shall we? I should probably pull it up. So the list is my favorite thing to make every year, mainly because it gives you something to actually kind of base your decision off of. I'm going to drive, probably not talk to you. So let's let that happen. So while I fill up with gas here, let's talk about the first plan on the list, and that's going to come from Medical Mutual, and it's their 6,400 HSA. Now remember, all of their plans now are going to be HMO, so keep that in mind. If you're buying on healthcare.gov, it's going to be called the Market 6,400 HSA. They're getting ice, or I don't know, it's a big truck. Basically, this is the plan that you love to hate, and honestly works for 95% of people who don't have a lot going on and are okay with paying, you know, the limited amount of medical treatment that they do get throughout the course of the year. It's going to give you the option to pay the least every month for your health insurance. Yeah, I mean, people are paying that. I mean, I've got actually, to be honest with you, I got a guy over on the western side of Ohio who has a family of 4, and their premiums were $1,400 a month, and he would be happy to pay an insurance company $1,400 a month, but there's only Medicare provider companies in his county, and he's freaking out because that he doesn't have an insurance company to buy from that he would want to give them $1,400 a month. So the next plan on the list is going to be Medical Mutual's 4,000 HSA, which is very similar to the 6,400. Almost so much so that really the only difference is that you're dealing with $4,000 deductible or $8,000 for the family versus the $6,400 or $12,800, and that's kind of it. This plan has really gotten a lot more expensive over the last couple of years, and it's really hard to recommend. The only time that you would really want this plan is if your medical cost sits somewhere in between those deductibles, between $8,000 and $12,800. Otherwise, you're going to save yourself money, and you're just going to make a better financial decision long term with the higher deductible. And I guess I should also say that if you're going to have like a lot of expenses, then that would maybe be a better choice, because it is going to be the ultimate lowest out-of-pocket cost. Having a $4,000, $8,000, if you know that you're going to blow through those deductibles right away, then that's going to give you probably the lowest out-of-pocket cost total. So before we talk about anything else on the list, actually I'll get this taken care of at the Avenue Hair Salon. And that's better, right? A little bit, I think. I don't know. Camera died, so maybe I finish this with my phone, but probably not. I don't know. Maybe we'll finish when we get back to the office. I mean, like the home office, not this office, which kind of sucks. We'll see. Well, so here's the thing, right? Rookie mistake. I forgot to bring an extra battery, and the battery died, and I definitely didn't continue recording on my phone. So we're just going to do it like we normally do. The next plan that we need to talk about is again coming from Medical Mutual. It's their HMO 2030 plan. Basically 2,000 is the deductible, 30 is the co-insurance portion of it. They usually think they're clever in the way they name these things, but almost everybody, I'm sure you didn't know that, right? You didn't. If we're being honest, really this plan's primary function is to be a plan that's going to offer you some co-pays for doctor's office visits and prescription medication. If you think that your medical treatment throughout the course of the year is enough to warrant, spending extra money on this plan just to get those certain benefits, then this is probably a good one to start and take a peek at and maybe consider. Next, the Cleveland Clinic plus Oscar Bronze plan. Now this is very new. This is the plan everybody is kind of asking. Not everybody. This is the thing nobody really knows about, right? So Cleveland Clinic has parted ways with Medical Mutual for their individual plans only. Again, remember, only plans that are purchased on your own through healthcare.gov or directly with Medical Mutual, just individual plans, ACA, Obamacare plans. This new partnership, Cleveland Clinic has partnered with Oscar Health to be their health insurance company of choice for 2018 in the state of Ohio, and they're only selling in a handful of counties around the Cleveland area immediately. And I just picked their bronze plan because I like bronze plans. Usually they make more sense for people financially than anything else. And honestly, if you're looking for something that has the Cleveland Clinic and network and you live in one of those counties around Cleveland, then this is going to be something, really one of the only things you can consider. But this particular bronze plan is going to have a $3,500 deductible and a $7,000 total out-of-pocket maximum for a single person. Your co-insurance after the deductible is going to be 50%, so a nice 50-50 split. But again, really the primary attraction here is just the Cleveland Clinic. If you are highly invested, need a lot of reoccurring care at the Cleveland Clinic in 2018, and you cannot possibly fathom switching doctors, then this is going to be the plan for you. Probably, maybe, sort of. Think about it, but it's here, right? And I'm going to just toss in, well, what about an honorable mention? Because everybody likes to try hard and maybe get recognized for it sometimes. The honorable mention here is MedMutual's 7,350 plan. Again, this plan is a little bit more appealing this year than it was last year, as the price gap has widened between this plan and the first plan on the list, the 6,400 HSA. They've separated themselves just enough to be even more annoying than it was last year, for something to consider if you're looking for the absolute cheapest option with Medical Mutual and are okay adding a couple $100, well in this case about $1,000 to your overall out-of-pocket costs. Again, like I said, I know it's annoying. If you're looking for the bottom dollar, this is going to be it with the most rock-solid, steady-ish insurance company that we have kind of still doing business in Ohio. So again, like we say every year, what about all those other insurance companies? And this is the question that I've been asked probably more than anything else. Well, there's probably a few, but it's up there. Where's everybody else, right? Well, the answer is that they're all gone. Medical Mutual, CareSource, Molina, Summa, Oscar, I forgot Ambetter, CareSource, Summa, Paramount, and Premier. All of those companies, again, offer such limited networks and or kind of the overall experience that they might provide. I just can't for the life of me put them on this best of list. But if that's all you've got, literally, like if that's the only company you can buy from in your county in Ohio, then I mean, they're not that bad, right? Something's better than nothing, so I'm sorry, I didn't mean it. So let's talk about what's the bottom line, right? I mean, just when you think things can't get any worse, they do. I mean, you're gonna have a lot of tough decisions to make when it comes to picking the right health insurance company this year. Unless you already had an HMO plan with the hospital network of your choice from last year, you're definitely gonna be compromising on either your insurance company choice or your doctors and hospitals choice, potentially. And if you are one of those lucky ones, well, just consider yourself one of the lucky ones. But again, it's also important to remember that this list is created as a general guide for the overall could work for the most amount of people, and there are very specific instances in where none of these plans might work best for you. You have to consider that there might be something out there that's going to fit your specific situation just a little bit better. So what's the next step? Well, if you're ready to actually see which plan, if one of these are going to work best for you, let's go ahead, click somewhere around here. There'll be something to click on to either schedule a time with me or take a deeper dive into what's next. So, but of course, as always, I do appreciate you for taking time to watch this video. And as always, I am Joey Giangola with Giangola Insurance. Take it easy, everybody. Sure, that's not a problem. Okay, yep, that'll work for me. Not a problem. It was a pleasure talking. You have a good day, okay? Thanks a lot.